Welcome to the All Recovery Talk podcast, where we talk all things recovery and substance use related. We're your hosts. I'm Kevin.
And I'm Lenny. This podcast was made for people in recovery, people with substance use disorder, allies of recovery, and everything in between.
Both Lenny and I are in recovery and work as peer support specialists at the only nationally recognized recovery community organization in North Dakota. Welcome, everybody, to All Recovery Talk. This is part 2 of our treatment series. Welcome, Jennifer.
Hello.
How are you today?
I am excited to talk about treatment.
Yes, indubitably. So, some of you may have heard, last episode was part 1 of treatment. So, what are we going to do for part 2?
I don't know. I guess keep talking about treatment.
Oh, okay.
I think where we left off was just kind of some brief talks about our experience, but I don't know that we talked too much about how to find the right treatment program or if treatment is right. So maybe we talk about those kinds of things. What we did, all of that.
Okay. So, how do you want to start off then?
Well, I guess why don't you share your experience with how many different treatment programs did you go to? What was the process of getting into the ones that you did go to?
Okay. So, I've been to let's see. 1, 2, 3. Yeah, 3 different treatment facilities throughout my active addiction. The first one that I went to was a state-ran facility that involved coming in and letting them know that I need some help. And you go through a process called open access through the state, which involves doing a questionnaire, and then you do a HUDAS assessment, which stands for a World Health Organization Disability Assessment Survey. And based off of that survey, it'll give you a score to see whether or not you qualify for that facility. And based off of that score, if you do qualify, depending on what the score is, will be dependent on what level of treatment, ASAM level that you will be scored at.
So you just walked in, decided you want treatment, and just walked in.
They told me, well, as long as you're here between 8 to 3, that's all that matters. Didn't have to make an appointment or anything like that.
So you just decided that you wanted to check out treatment?
No, I was kind of court ordered. So,
Checks out.
yeah. So I had to find a treatment facility, and that at the time was the only one that was inpatient, other than Trinity. So I went through. That was the process of going into North Central or a state-ran facility. My second treatment, which was Trinity CDU, I had to call and I had to make an appointment to go in and have an assessment done. Their assessment was different than North Central's. Based off of my assessment, then in turn, they decided whether or not I qualified for their services. That is the same as the last treatment facility that I went to, which was New Freedom Center in Bismarck. I had to call and schedule an appointment. Some of you may have heard me talk about New Freedom in past episodes. I believe it was in episode 1 where I discussed about how I found a treatment facility, and I went there solely based on they had a pool table. So theirs was making an appointment over the phone evaluation, them making a decision, calling me back, and then giving me a date when I could come in.
Cool. So all of those were court suggested?
No, just North Central was court suggested, and then it was me failing out or getting kicked out of North Central to then in turn my PO telling me that I better figure something out,
So that's when you went to the second one?
and then the third one.
So you kept going to treatment because you liked treatment, or did you
No,
want a new way to
because-
live?
No,
or-
I went through. So I went to the second treatment facility after being kicked out of North Central, and I lasted a week. And due to an employee that worked there and some past childhood trauma, I just didn't feel that I could be successful in that setting. So I left and I used, and um, I called my PO and was like, "Hey man, I left that treatment facility. This is why. Just to let you know, I've relapsed since leaving there, being clean for a week." And he told me, you still have the option to figure it out before we figure it out for you. So I had a friend that was that I've known for a very long time that I used to use with, and all that stuff that was at New Freedom in Bismarck, and he had when I talked to him, he's like, "Dude, they got a pool table down here," and I was like, "Oh, let's go," and. So when I called down there and I'm like, "Yeah, I'm trying to find some treatment services. Question though," and she's like, "Yeah, shoot." And I'm like, "Do you have a pool table?" And she goes, "That's a weird question. And how do you know that?" And I'm like, "'Cause I have a friend that goes to treatment there or went to treatment there. I don't know if he's still in treatment there, but he told me that you guys had a pool table and I really like to play pool." She's like, "Yep, we have a pool table." And I was like, "Sweet. How do I get signed up?" And, the rest was history as far as me going to treatment. That was the last treatment facility that I went to. Yeah,
So it was pretty much consecutive.
in essence, yeah. Within a 6-month span.
Okay.
Oh, not even 6 months. I went to North Central for probably 3 months, and then I made it after that. Then I made it a week at Trinity, and then I went to New Freedom. Shortly after that, I think it was a week or two after I got out of Trinity that I ended up at New Freedom.
So you found it pretty simple to get into treatment, find treatment, stuff like that. Did you have any
mean,
issues?
For the most part, I did because while I was at North Central, they had had me sign up for Medicaid expansion, so I had insurance that would cover treatment. It wasn't we don't take that type of insurance, things like that. So it was just like, "Oh yeah, come on, you got the good insurance, come on down." And it wasn't, that, "Oh, your insurance will only pay for so many days." So, yeah, for the most part, I guess I didn't really have any issues with going to treatment as far as getting into treatment.
That's pretty nice, and not really much of a waiting list either.
So North Central didn't, Trinity didn't, New Freedom, the way that they do it is that they do, they're not like a revolving door type of treatment facility where it's some are coming in and some are leaving. They do it as groups. So then it's if you're not signed up within a certain date, then you have to wait until that one group is done. Which was really nice because then it wasn't just like, "Oh, there's new people. Oh, there's new people. Oh, there's new people." It was the same group of people because they were a smaller treatment facility, so it was I think it was like 15 people at max that they allowed per treatment group. So it was nice. I liked it versus going to the other facilities and there being 35 people there. And it being that revolving style where there's always somebody leaving and always somebody coming in, to where you're never really getting to know the group, because it was only one group. We had counselors, we had 2 different counselors, but we always met in the same group room. It was all of us at the same time. It wasn't that, "Oh, you're in this group at this time and you're in that group at this time." Was always the same people.
Interesting.
It was really nice. It made it feel like, you weren't just there, that you were included in everything. It was, and I liked it because the group was 8 a.m. to 3 p.m. It was, you got an hour for lunch, but you were in treatment from 8 to 3. There was so much more structure than the other two. Whereas the at New Freedom, you would go to group, and then depending on what time the meeting was, you were going to a meeting every 6 days a week. Sunday they would let you have off because that's God's day off, so they didn't force you to go. If you could go if you wanted and you had a ride, but for the most part it was, they had it set up to where 3 days a week you went to AA fellowship, the other 3 days you went to NA fellowship, which allowed somebody to figure out where they fit in, or didn't fit in.
Awesome.
hmm
So pretty 12-step based.
Yeah, I mean, all treatment facilities for the most part are 12-step based, really.
Or at least they were when you went.
Yeah, I mean, a lot of them still are to this day. I mean, unless you go to a specific treatment facility that is a non-12-step based, most treatment facilities are 12-step based.
Okay. And were your 3 treatments, were they all fairly different? Because you've talked about your last one.
Well, they were
quite a
completely
bit,
different.
but-
They're completely different. They because they're all ran with different models. North Central was run on the old Trinity model, which was, let's focus on. Well, I mean, Trinity CDU and North Central in essence were the same, like, addiction recovery treatment model, but the groups were different. The way that the groups were ran, how long you were in treatment groups for, those were different. New Freedom was more of a, like, one-on-one type based treatment. It was completely different. It wasn't that, that this hour you're doing CBT or DBT like North Central. It wasn't that the groups had different names to it. It was just that you're in group from 8 to 3, and whatever the treatment counselor wanted you to work on, that's what you worked on.
That sounds pretty cool. So you found that specific model at your last treatment was the best
Mhm.
for you?
Well, now that I think about it, they ran a recovery capital model, and didn't even know it at the time. They didn't call it that, because every week, at the end of the week, you would get a sheet that you would turn back in, that the counselors would ask you, okay, so what do you feel you need to work on for the following week? And then you would turn it back in, and it would have questions on what you felt worked good this week, what you feel you need to work more on. Do you need more materials, for certain things, which is the recovery capital model. It allowed me to be a part of my treatment plan.
So that personal initiative really had
A huge
lot.
impact.
Yeah.
Huge. It was that made it feel like I wasn't just, another number to treatment. It allowed me to feel that, they were that inclusivity that they gave me by just handing me that sheet of paper, to where I could request that, hey man, I need to work on my anger, or I need to work on grief, and they would give me workbooks. In essence, the same workbooks that I utilize today while doing peer support is what they would give me while I was in treatment. And it allowed me to recognize things that normally I didn't, or I hadn't in any of the other treatment facilities. The other treatments, you had to do a life history, you had to do a usage history. Same thing I had to do at New Freedom. It's just that they've allowed you to be a part of your treatment plan. It wasn't just your treatment plan was dictated by professionals.
Okay. So do you think that for someone who's maybe never been to treatment and they're looking at their options, um, do you think that it was helpful to start out where someone was telling you what they thought was best, or
No, personally, I think, if somebody's looking for treatment, treatment is what you make of it. If you go in wanting something different, you will get something different. Um, I'm a firm believer that, being a part of your plan versus somebody just telling you what you need is a huge game changer. The recovery capital model is, I believe, in my eyes and in my opinion, the best model there is for treatment. Because it allows me as an individual to work with my case managers, my LACs, to come up with a plan that I believe will benefit me to the best of my ability versus what they think I need. Because I can't read people's minds. I can read my own mind because it is my mind. So, when they're asking me what do you want, what do I need? Well, I need to work on these areas. Well, we never would have came up with that if we didn't ask you.
interesting?
So then it allowed me to, not be so defensive towards them telling me, "Hey, you're going to work on this." No, I'm going to work on this because I requested to work on this.
Interesting. You have a little bit different experience than I do with that.
Why were you told what you were going to do?
A little bit, and that's what I needed because I thought my only problem was drugs. So I didn't know what I needed to work on other than not use drugs.
Mhm.
So but my experience, I only went to one treatment center, so I went there twice, but only went to one, and I had a very different experience both times. So
Well, I mean, yeah, your treatment also lasted from like 8 to 10 p.m.
yeah, it was a long day.
Yeah. Like
10
a
p.m. if
treatment
we went to a
camp.
meeting.
Well, okay. Oh, so they included a meeting as part of treatment.
Once a week.
Oh.
Yeah.
Okay.
A meeting was once a week.
Mm.
I
At the
wonder-
facility?
No, we went out to different meetings, and it depended on all of the counselors were in recovery, so we went to their different home groups depending on, I guess, whatever they thought was best. Different ones had topics or whatever, so they just kind of decided which ones they felt like going to, I guess. I don't
Okay.
know.
So I shared my experience with treatment and how I got there. So what's your experience with treatment and how you got there?
Well, I didn't want to go to treatment. Um, I but I did want a different way to live, so I called a treatment place in Minnesota. Keep in mind, this is when I was living in New York, and I didn't qualify for any of the state programs there because I wasn't a resident of New York technically,
Mm-hmm.
and so I couldn't get into any of those. So I called a place in Minnesota, and I spent, oh gosh, probably an hour and a half to 2 hours doing an interview. Um, and they decided that I would be a good fit, but I decided I wouldn't, so I never went.
Mm.
Because I thought, why would I want to go to Minnesota? I live in New York,
Mm-hmm.
Then time went on, and my mom actually suggested going to the treatment center I ultimately went to in Tennessee, and I did not want to go there. I wanted nothing to do with Tennessee. I wanted to stay where I was. But then I looked at their website, and it was on a lake.
Oh, they had a
So,
lake. Okay. Yeah,
They-
I had a pool table. You
Yep.
had a lake.
Yep, they had a lake and mountains and trees and stuff. And it
Okay.
seemed pretty nice.
Yeah.
So also very materialistic,
Oh, yeah, that checks out.
Yeah, like the pool table, but for me it was a little different. So I don't even remember if it was me or my mom that called them, but it was a pretty simple okay, you think you need treatment? Come on in then. And they bought me a plane ticket. And they would only buy it the day that I was leaving because apparently they got screwed over quite a few times.
Mm-hmm.
And then they picked me up from the airport and brought me on over. It happened to be directly across from the Knoxville airport, so it was pretty simple.
Oh, just a stone throw away.
Yeah, quite literally.
Mm-hmm.
And so I got there. Also I chose them because I could still smoke cigarettes there.
Oh yeah, yep.
That was a big part of it. I was not about to give that up too. Which I found out later, they frequently debate, but keep allowing people to smoke cigarettes because they feel like not as many people will come to treatment if they can't smoke cigarettes, which is probably fair because I probably wouldn't have.
Yeah.
But I got there and started out in intake where they did a whole bunch of basic questions. I mean, keep in mind, I was not, I was under the influence when I got there. Because when you fly in an airplane and they buy you, what is it? The, not main cabin and not first class, the one in between, free alcohol. So,
Ooh, some Comfort Plus.
yeah. So, I was not in a sober frame of mind, and they searched all of my stuff, and they had to send it through some weird thing to make sure there was no bugs or something. Not really sure. It was very elusive to me. And then I got into my detox room. They decided that because the substance that I was mainly using was not something that I needed to be medically detoxed off of. The next day, I started my 200-question questionnaire to figure out what I needed to work on, I guess, or whatever.
That seems excessive.
A bit, yeah. But I lied on most of it, so it didn't work out the first time. But then I got oriented to the inpatient program, started going to groups, and had homework in that as well. I had to do a whole bunch more questionnaires to find out what my problems were. I think I had them all, so I don't know. But
Just
that's
a hot mess.
really, really a hot mess. Yeah. But they had some generalized things. You know, it was 12-step based. So we started on step work, but also doing things. The only group that was different, like you described, the whole people go together or whatever. So at, I think it was 4:00 on Tuesdays, if you were in your first 2 weeks of treatment, then you had to go to this like newcomers thing where they taught you about what addiction is, which was really interesting. One of the anecdotes that teacher said is something that I use very often in my life today. But then after you were done with that, then you got to go learn about how you may contract HIV and things if you continue using. So that was fun.
Sounds interesting.
Super.
Yeah.
And the only other class that was different, or group or whatever, was some people did cognitive processing therapy while others did cognitive behavioral therapy. Other than that, we were all together all the time and had individual therapy and psychiatry appointments, family therapy appointments. All of it was included in the 8 to 10 kind of thing.
Sounds interesting. I mean, that, so my treatment stays, didn't involve a therapist or anything like that. While I was at North Central, I got a therapist that I would see every, once a month because she was so busy. But it wasn't, part of my treatment plan. I requested a therapist just to see a therapist because I had some, childhood trauma that I wanted to work on and stuff like that. But, it wasn't required of me to do, which I kind of like that they made you go to a family therapist, psychiatrist, as part of your treatment plan.
Yeah, it was a whole lot.
It seems like a whole lot, but I mean, once you get used to it, I mean, it's just a part of the routine, I suppose.
It was definitely good, and I think that it would have been super helpful if I would have stayed in the same town long term.
Mhm.
Because I did stick with the same psychiatrist for quite some time. But then I had to, of course, change when I moved here,
Mhm.
because different state and all
Mhm.
that. But yeah, I think the biggest difference, I got to choose a little bit of what I wanted to work on, but with all of the quizzes and surveys and all of that, they gave me a list of things that they thought that I should work on.
Mhm.
Um, and we all got individual assignments based on that. Um, but we got to choose what we wanted to work on first.
Mhm.
But it's still, it was a list of like 17 things that came with homework assignments and stuff to
Yeah.
figure out.
So in a way, it was a partial recovery capital model, because the questionnaires are allowing you to recognize and identify things that you need to work on. So then they would individualize your treatment plan based off of those questionnaires.
Right.
So in a way, it is a recovery capital model to some extent.
Right. But I definitely would not have, thought that I needed to work on all those things if it hadn't been prompted.
Mm-hmm. Well, I mean, most people when they get into treatment have no idea what they need to work on, other than I'm here because I have a drug problem,
Right.
or I have a mental health problem. I don't know how to change either of these issues. So, what do I do next? So based on that, back to the question of how does one choose a treatment facility?
Sounds like we both chose based on some pretty materialistic things.
I mean, so in essence, yes, but based off of the knowledge that I have now and that we have now, the materialistic things helped me, yes, but and it all boils down to the curriculum, how they do treatment. So I think, if you're new to treatment and you're looking for a treatment facility, call around and see, how they do their programming. See if they have recovery capital as their model, to where they're allowing you to be a part of your treatment plan. Things like that, it's just like, how we say, man, if your drug dealer doesn't have what you want, well, you don't just go without drugs, you call a different drug dealer and find, until you find the one that fits you, and I think that can be the same with treatment. Calling around to be like, hey, so I'm just checking in to see what your program is like. How many days is it? What type of setting do you guys do group in? Is it a revolving to where people are leaving and people are coming in, or is it that it's, a group starts at the same time and they end at the same time? Is it, is it a big group? Is it a small group? How many counselors will I be working with? All of these questions, like when you go to the doctor, you don't just go to the doctor and not ask questions.
Some people do.
I know, but I mean, if I'm trying to get something done, I'm gonna ask questions, so that I can get the most out of what I'm doing, so I don't have to continue doing it. That's my take on how to find a treatment facility.
Is there also a consideration on inpatient versus outpatient?
I'm a firm believer that inpatient is a lot better than outpatient.
I mean, that's my personal experience as well, but I also do know, when both of us went to treatment, we didn't have any children.
Hmm.
Um,
So
and,
there's
and not everybody has the opportunity to, have someone take care of their child for a month.
so there are treatment facilities that do accept children nowadays. Here in Minot,
Too.
we have Providence House for Women. They accept children up to the age of 8.
8?
8, I believe. Yep, I believe it's 8. Um, they're not quite accepting women with children yet, but hopefully soon. But there are a lot of treatment facilities nowadays that are recognizing that the benefits of allowing children to come so that their parents are able to seek services because of that factor of where do the kids go if I go to treatment? I don't have anybody to watch them. I don't have
Right.
any place for them to go.
And where do the dogs go? There's just, I'm just bringing up these questions because these are real questions that people have.
Yeah. So with dogs, yeah, there's boarding kennels. There's, you can always, talk to shelters to see if they have people that can foster while you go to treatment, things like that. There's options if you ask for the help. That's the main thing that treatment is your first call for help. Reaching out to um, you know, organizations that work with individuals in recovery or seeking recovery, asking them questions. Hey man, I want to go to treatment, but I have a dog and a cat. Do you know where they could go while I'm in treatment? You know, they may have the information, or reaching out, to them to be like, hey, can you help me figure out what we can do with them? Things like that.
Right. And treatment centers might have answers for that too.
Yep. Yeah. And when I worked at North Central, there was a guy that had a dog. His name was Whiskey Pete, and one of the counselors or the case managers would watch Whiskey Pete while he was in treatment. Um, because she loved watching the dog. Dog was great, and she knew the benefit of her watching the dog would help the individual. So she went above and beyond in that aspect of helping him out by doing that.
That's pretty amazing.
Yeah, yeah, it was extremely nice of her to do that.
And we talked last time, about how the people working in this field really have a passion because they aren't in it for the money. So
Hmm.
so a lot of people, whether they're working in treatment or community-based organizations, will go above and beyond
Hmm.
to make sure that people are able to get the help they need.
Yep, that is something that I've seen a lot of is in this field is going above and beyond so that the individuals have the opportunity.
Yeah.
So on that note, if you are seeking treatment, you know, look through Google treatment facilities. Um, Give them a call and be like, "Hey, man, what you guys got going on? I'm trying to find some help, but I want to know more information about your guys' program and what it all entails. How many days? What insurance do you guys take? That's a big one. Is what insurance do you guys take? Here in North Dakota, if you do not have insurance, you can always apply for what is called the SUD voucher through the state, which will allow you to be able to go to treatment. Uh,
And a lot of treatment centers will help you apply for that
yep,
too.
yep, they sure will. But for the most part, a lot of insurances nowadays are realizing that, substance use treatment and mental health treatment are a much needed thing and are doing a lot better at covering those services.
Right. And a good place to start too, if you don't want to Google and ask places what insurance they call, is calling the number on the back of your insurance card.
Yep.
They'll tell you where is covered and all of that. Just ask them all the questions,
Yep.
and they'll
So,
give you the phone numbers.
so today's call of action is if you're seeking treatment, to call treatment. Get the help that you need, the help that you deserve, and don't just settle. on the first treatment that says they'll accept you. There are many treatment facilities out there. There are many treatment facilities out there that also tied to sober living houses, so that when you're done with treatment, that you can enter into sober living if you feel that is necessary. So get the help. You deserve it. You're worth it. Anything else there, Jennifer?
Nope, I don't think so.
All right. Well, you guys have a great day. We'll see you next week for next week's topic of
To be determined.
I don't know. I'm looking at my list here. So we've got, what does recovery mean? Harm reduction or sober living? It'll be one of those 3 topics, so tune in.
What about making the decision for myself?
Well, in essence,
We'll see.
making the decision for myself is, there we go. It'll be one of those 4 topics next week.
Or maybe something else, who knows?
Yeah, who knows? Tune in, find out. See you next week. Have a good weekend, everyone.